Hi everyone. Now we are going to discuss about the types of anesthesia. First, definition of anesthesia. The use of drugs and inhalational agents that makes the patient unable to feel the pain during surgeries and also it induces sedation to unconscious stage. Next, types of anesthesia. Anesthesia is classified into general anesthesia and regional anesthesia. Regional anesthesia is further classified into nerve blocks, which has peripheral nerve blocks and central neuraxial blocks, and local anesthesia. Next, we are going to see about general anesthesia. General anesthesia are the drugs which can cause reversible loss of sensation and consciousness. Classification of general anesthesia. General anesthesia is classified into inhalational anesthesia and intravenous anesthesia. The next one is features of general anesthesia. First, loss of all sensation, especially pain, induced sleep and amnesia, immobility and muscle relaxant, abolition of somatic and autonomic reflexes. Next, triad of general anesthesia. So the triads are narcosis, analgesia, and muscle relaxation. Next, we are going to see about the components of general anesthesia. First, narcosis, analgesia, muscle relaxation, amnesia, abolition of reflexes, maintenance of normal hemodynamics. Next, the stages of anesthesia. So the stages of anesthesia has 4 stages. The first one is stage of analgesia. So it is from analgesia to loss of consciousness. The second stage is stage of excitement. It is from loss of consciousness to rhythmic respiration. The third one is stage of rhythmic respiration. In stage 3, it has 4 planes. So the first plane is from rhythmic respiration to cessation of eye movement. The second one is cessation of eye movement to respiratory paresis. The third one is respiratory paresis to paralysis. And the fourth one is respiratory paralysis. And the fourth stage is medullary paralysis. Next, we are going to see about regional anesthesia. Nerve blocks may be classified as central neuraxial blocks, which means spinal and epidural, and peripheral nerve blocks. Nerve blocks are given either for regional anesthesia or for acute and chronic pain relief. Next, we are going to see about peripheral nerve block techniques. The conventional method of giving a nerve blocks is by electing paresthesia and or by using the nerve stimulator. But in modern days, the use of ultrasound has been practiced in every hospitals. The next one is central neuraxial blocks. First, spinal anesthesia. A spinal anesthesia is also called as spinal block or subarachnoid block is a type of regional anesthesia that involves injecting a local anesthetic drug into the subarachnoid space. It is usually given between L3 and L4 vertebra. So the layers of spinal are first skin, subcutaneous tissue, supraspinous ligament, interspinous ligament, ligamentum flavum, epidural space, dura mater, arachnoid mater, subarachnoid mater, pyomatter, mater, and the last one is spinal cord. Next, epidural anesthesia. It lies outside the dura mater, that is between dura and ligamentum flavum. It extends from foramen magnum to sacral hiatus. Epidural anesthesia is given in this space. So the epidural space is triangular in shape with apex dorsomedial. It is mainly used for post-operative pain management. Contents of epidural space: arteries and posterior nerve roots, epidural veins, spinal arteries, lymphatic discs, and the last one is fat. Next, local anesthesia. Local anesthesia is defined as the technique to induce the absence of sensation, typically pain, in a specific small area of the body using special drugs called local anesthetics. The commonly used drugs for local anesthesia is lignocaine and bupivacaine. Thank you.